సార్ కొంచెం లోపల రండి.
లోపల రాని
అది పెట్టలేదు కూడా.
విజువల్ తీసుకుని
పైన కూడా వచ్చేటట్టు చూడండి.
మేడం పెట్టేసి సార్
Yes, so we are coming today to talk about how to come to UK and how Indian doctors can manage to come to UK and prepare for their exams until they get a job in UK. And thank you very much for everybody who's welcomed us, for Apollo Hospital, for everyone who actually made this happen. Yeah.
Yes, please come.
Dr. Sobhy, okay, and he has flown all the way from UK to help us understand the process behind our UK, how to pass the UK exams, that is PLAB 1 and 2 and maybe UKbyDr, which is PLAB. So it's my pleasure today to introduce Dr. Sobhy. He is an alumni from Alexandria University. He has an incredible experience in orthopedics from Liverpool University, UK. He is right now currently pursuing GP training from St. Helens and Knowsley hospitals. He's been recognized for his remarkable teaching skills, especially in the areas of PLAB 2 and OSCE. So he is currently relocated because owing to his remarkable teaching skills, he has been relocated to Apollo Buckingham Health Sciences. Okay, and he's also an examiner, OSCE examiner for Liverpool University. And so let's welcome Mr. Sobhy and let him take over. Thank you.
How are you guys? How are you doing? Okay? 180 in 3 hours, yeah? In one paper. That is one paper, 3 hours, 180 questions, okay? Once you finish, the final step is called UKMLA Step 2. UKMLA Step, write it down because some details here. UKMLA Step 2. Okay. What is it about? First of all, guys, step 1, exam. UKbyDr step 1, let's agree on something. Where do we have the exam? Where is it conducted? Where is it conducted? Where? Guys, in your country, in India. For Egyptians in Egypt. Okay? For India in India. But step 2, it is only in UK in Manchester. Guys, are you focused? Are you guys? This boy is naughty. Yeah? He's quite, you know. So what is step 2? What's your name? Huh? Yeah. So what's step 2? Step 2, where do we do it? Do we do it in Hyderabad or Kerala or Chennai? You choose one of these 3 cities. Chennai? Kerala? So we only do it in UK. Step 2, UKbyDr only done in UK. Okay? You will get the visa through the test. When you book the test, you actually get a visa called visitor for the reason of the test. Okay. What is this UKbyDr Step 2? What is this exam? Guys, write down, it's hands-on. Write down. Hands-on clinical OSCEs. So, step 1, UKbyDr, it's on the computer, it's a questions. What does that mean? It's just you and the patient. But the patient is not a real patient. He's a simulator. He's what? So they bring a simulator, you and the simulator. Clear? Guys, clear? You and the simulator. Okay, which one is more difficult? Step 1 or step 2? You came in step 1 or 2? Which one is more difficult? Step 2. Why? Because step 2, there is an examiner sitting there, and you and the patient, and he's watching every move. He's looking at you as a doctor and in the consultation. So, step 2, how is the exam? How many OSCEs? How many OSCEs in step 2? Guys, 16 OSCE. Write down. It's 16 OSCEs. Guys, are you there? How many OSCEs? 16. You and the patient. But the patient is a simulator. Okay? So, how many minutes do you leave for every OSCE? You have 16 cubicles, and every cubicle has a simulator who is simulating a certain condition. So you talk to him as if you are talking to a patient. Let's say he's simulating. He is actually having a script of a condition that he's coming to simulate for. He's easier than a patient because he's coming to simulate a certain condition. He's not like a patient will get you lost. Okay? He's coming to simulate a condition as a patient. Now, we said 16 OSCEs. How long for every OSCE? So you and the patient, you and that simulator, how long would you have? How many minutes in every OSCE? Guys, 8 minutes. The OSCE is how long? 8 minutes OSCE. Okay. In front of the door outside, at the door, you have write down 1.5 minutes to read the question. So outside you have 1.5 minutes to read the question, and then you enter the cubicle and you have how long? 8 minutes inside. So, what do they assess you on each OSCE? What is the assessment like? Guys, so how many minutes at the door to read the question? 1.5 minutes. How many minutes inside? 8 minutes. So 1.5 minutes outside and 8 minutes in the cubicle. Now, what do they assess you on? Write down, guys. 3 domains. Write down, please. Write down, please. 3 domains they assess you on. They assess you on 3 domains in every OSCE. Number 1, history taking. How good you are in taking history and asking for differentials. Number 2, management skill. Are you good in managing or not? So history taking, management, and the third point they assess you on is, write down, this is very important, communication skills. So let's break it down quickly. Step 2 is what? Is it written? Is it on the computer? Is what? Step 2 is what? Hands-on. Whom are you dealing with in the cubicle? A patient who is a simulator. How many OSCEs? 16 OSCEs. Every OSCE at the door, how long would you have? 1.5 minutes to prepare yourself. You enter the cubicle, you have how many minutes? 8 minutes. What are they assessing you on? 3 domains. History taking, management skill that you reach your diagnosis and manage, and communication skills. Okay. There is something very important here to tell you guys. In this OSCE, PLAB 2 or UKbyDr Step 2, listen, communication skills, if you are not good in communication skills, you will never ever pass the exam. I need you to highlight it. I need a star next to this. So please circle communication skills. Circle. So, listen carefully. Each OSCE is how many domains we assess you on? 3 domains. Write down 4 communication skills, number 4. Write down 4. 4 history taking, 4 management, 4 marks. So how many marks for management? 4. How many marks for history? How many marks for communication? So each station, each OSCE, how many marks? 12. Divided equally 3 domains. But listen to this trick. Listen to this trick. In an OSCE, listen to this because many people come to UK to pass step 2 and they struggle a lot because of little things here. In an OSCE, you will never find a candidate who scores 1 out of 4 in communication. 1 out of and passes the station. Meaning, every station has a mark at the end, a passing score. Okay? Say the passing score is 7. The passing score is 7 out of 12. So say the passing score. Some people, they study from 2, 3 resources. Is that wrong or right? What do you think? That's wrong. That's wrong. Wrong. Only 1 resource, 3 times, 4 times is okay. So focus on 1. 1 resource, 3, 4 times. Repeat it. Guys, and you will be surprised because the exams actually comes from the question bank, same age, same name, same complaint. From the first 2, 3 words, you read, you answer without carrying on the rest of the question, honestly. But if you go through textbook, you're not gonna manage it. You need long time. Okay. Now I prepared the English test. I applied for UKbyDr step 1. I got the question bank. I read it. Do not go the question bank unless you read it minimum 3.
అసోసియేట్ డీన్ అకాడమిక్స్ అపోలోలో. సో మాకు అపోలో బకింగ్హామ్ కాలేజ్ అని యూకేలో ఉంది. సో ఈ డాక్టర్ సోభీ అక్కడ వర్క్ చేస్తారు అండ్ ప్లాబ్ ట్రైనింగ్ ఇస్తారు. సో అపోలో మెడికల్ కాలేజ్ హైదరాబాద్ అండ్ స్టూడెంట్స్ మాకు ప్లాబ్ కోసమని ఆ ట్రైనింగ్ కోసం ఇక్కడికి వచ్చారు. పిల్లలందరికీ ఇక్కడ ట్రైనింగ్ ఇచ్చి 1 డే ట్రైనింగ్ ఉంది. ఈ ట్రైనింగ్ తర్వాత మళ్ళీ ఎవ్రీ ఇయర్ ఇతను వచ్చి మా స్టూడెంట్స్కి ట్రైనింగ్ ఇచ్చి ఎలా ఎంటర్ కావాలి యూకేకి ఎంటర్ కావాలంటే ఏమేమి అవసరము అవన్నీ ఏ ఎగ్జామ్స్ రాయాలి, ఎన్ని ఎగ్జామ్స్ రాయాలి అన్నది అతను మాకు చెప్పి వెళ్తారు. సో దాట్ మాకేంటంటే మాకు యూకేలో కూడా ఒక కాలేజ్ ఉంది కాబట్టి ట్రైనింగ్ అక్కడి ట్రైనింగ్ వాళ్ళు ఇక్కడికి వచ్చి చెప్తే ఈజీ అవుతుంది అండ్ మన స్టూడెంట్స్కి కూడా నేర్చుకుంటారు కదా. ఇండియాలో స్టూడెంట్స్కి కూడా అక్కడ ఎలా ఉంటుంది, కల్చర్ ఎలా ఉంటుంది, ఎలా ఈజీగా జాబ్స్ వస్తాయి, జాబ్స్ తెచ్చుకోవచ్చు అన్న దాని గురించి వచ్చినారు. ఇక్కడ 1 డే ట్రైనింగ్ అండి. మళ్ళీ చిత్తూరు మాకు మెడికల్ కాలేజ్ చిత్తూరులో కూడా ఉంది కదా, అక్కడ కూడా 1 డే ట్రైనింగ్. సో ఎవ్రీ ఇయర్ ఇలా వస్తే మాకు ఈజీ అవుతుంది, మా స్టూడెంట్స్కి ఈజీ అవుతుంది, ట్రైన్ అయ్యి ఎగ్జామ్స్ క్లియర్ అయ్యి యూకేలో వర్క్ చేయడానికి ఈజీ అవుతుందని అక్కడ నేర్చుకొని అక్కడ వాళ్ళు వచ్చి చెప్తే ఇక్కడ ఈజీ అవుతుంది కదా, వాళ్ళకి డిఫరెంట్ అర్థం అవుతుంది. అక్కడ కల్చర్స్ ఏంటి, ఇక్కడ ఎలా ఉంటుంది అన్నది డిఫరెన్స్ అర్థం అవుతుంది కాబట్టి మా స్టూడెంట్స్కి పెట్టాము.
Thank you.